Professor Amy Fairchild, are e-cigarettes a Trojan horse?
Well, that's the concern of many advocates, many longtime tobacco control advocates. The evidence to date is not bearing that out. That e-cigarette experimentation rates are up, but in fact, smoking rates continue to decline in countries that have e-cigarettes. So I would say at this point, no.
What sort of differences do you see in approach from the most restrictive to the least restrictive?
Well, I know less about the EU countries than I do say about the UK versus the United States. The United States has, in terms of rhetoric, a very restrictive approach, but still, in terms of actual the availability of e-cigarettes, a great deal of availability. I think one of the things that the question is not what the approach is so much, but what defines the difference between the approaches. I think a lot of it turns on openness to harm reduction as a strategy, and or a leaning towards a more precautionary approach, the kind of approach that would say we have to have all the evidence in place before we can take action. But in either of those cases, you always have to think about what are you measuring harm against. And in the case of tobacco, the point of departure always has to be the harms to smokers. You've got one of the most deadly products that's ever been created by man, and that's got to be the point against which you measure any kind of harm.
So, for example, restrictions like some people insisting that they're only sold through pharmacies, for example, or age restrictions. Do you welcome those, or do you think it's a barrier to people taking an e-cigarette rather than a cigarette?
Well, some things like age restrictions make a whole lot of sense. There's no reason that a kid should be having tobacco or any other kind of drug. But you're absolutely right. In terms of the restrictiveness of the kinds of measures, some are going to force potentially life-saving products out of the hands of current smokers. And it will depend on sort of how widely available are pharmacies. That's one avenue, but certainly that's going to make them less accessible to current smokers. The widespread vape shops is going to make them far more accessible, but then the balance is going to be you're going to have more youth uptake. The more venues where you can buy them, the more opportunities for people who don't need to be smoking e-cigarettes to have them.